like I said, right, I want to give
Mm-hmm.
you overview of the NCLEX, right? We are going to be answering question from this document. It's the NCLEX past question. I mean, question that have been previously tested on the NCLEX exam before, right? So,
Okay.
um,
Then
yes,
the
that's
answer
what I
should be
use
like,
to coach students so that at least you can understand directly from the NCLEX the way they write it, or other than using third party questions, right? But before we jump into answering the question, I want to show you how the NCLEX work. The NCLEX is not difficult, right?
okay.
You have been used to exams before.
Yeah.
So the NCLEX is not the first exam you ever take. But the problem is when students try to approach the NCLEX exam, they approached NCLEX exam the same way they approached nursing school exam. So that's the problem, right? Nursing school exam and the NCLEX exam, the only thing they have in common is that they have nursing content. That is the only thing they have in common. The testing style for nursing school and the testing style for the NCLEX, they are not the same. Because when nursing school tests you, it tests you as a student nurse. And when NCLEX tests you as a nurse. Now, as a student, you are required to pay attention to every nursing information you learned in nursing school, right? So your lecturer will walk you through various nursing information. Then when you are about to take your exam, it tests to see if you can remember all this nursing information you learned in nursing school. So nursing school exam is more of you doing recalling, right? Recall, right? But information don't make you a safe nurse, right? Like I can ask you right now and I can say um is it true that beta blocker is used for a client who have hypertension? You will easily agree with me that yes, it is true that beta blocker is used for a client who have hypertension. But does knowing this make you a safe nurse? No. Because one thing is this, we believe that beta blocker is used for a client who have hypertension, but if you start giving beta blocker to every single client, one day you are going to kill one client. You will just find out that you gave this beta blocker to a particular client and then you kill the client, and you will be like, why? What happened? I gave the medication that was prescribed. I followed the medication right, everything. I did not give more than the dose ordered, but why is it that this patient died after giving the medication? Why? Because this is just nursing information. Knowing beta blocker is used for a client who have hypertension is just nursing information. But as a nurse, there are some care that you need to carry out related to this medication administration. Right. So that's the main reason why, in order to use your nursing information um, in a safe way, you need to understand the care involved. It's the care that make you a safe nurse. That is the main reason why on the NCLEX, in order for the NCLEX to know if you are a safe nurse, it tests the care related to that information. So when you see NCLEX question, you don't want to pay attention to just the information. You want to pay attention to the care, because when you understand the care, it directs you. Um, it give you a clear direction how the NCLEX want you to approach that question in order for you to show that you are a safe nurse. If you don't understand the care in a particular question, you will not be able to show that you are a safe nurse the right way. You are just going to be battling with thinking of nursing information. So nursing information can cause a lot of things, right? Most especially if you rely on just nursing information, you will notice that you are frequently getting stuck between two answers. You will be one of those students that always used to say it looked like every of the answers seem to be correct, right? So or you start second guessing yourself, right? You are confused because you don't really understand what the question is all about, right? All that kind of stuff, right? These things happen when students only focus on nursing information instead of the care NCLEX is testing. So now, in order to pass the NCLEX exam, it's the same method you use with every other exam. There are just two things you need in order to pass the NCLEX exam or any exam. In order to pass the exam, you need to study the content related to that particular exam, and then you need to practice questions, right? The content make you like, it's just like, this is the writer of the exam and this is you that is taking the exam. The writer of the exam is going to use this content. You are also going to study this content. So it means that when you end up not taking the exam, there's no confusion between you and the writer, because the writer believes you study the content, you as well too, you study the content. So when you go on the exam, you are expected to be tested on this content. But content is not enough, right? It's just like, now I was discussing with a particular student a particular day, and I told this student, I said, if this is a car right here, right, and then this is me right here, and this is like you right here, and all I just did was to tell you how to drive this car, right? So all I just did was to just tell you. So I was just like having discussion with you. You don't know how to drive, right? You don't know how to drive now. But now I'm not telling you, okay, this is how you should drive the car. Once you get in, this is what you need to do. That is what you need to do, right? So I've given you audio information related to how to drive this car. Now, if at that point and I take this car with you to the highway, right? And I say, okay, now drive. Guess what? The chance of you crashing is 99%. Why? Because you are not even used to driving. You don't know how to drive, right? And all I just gave to you was information. You've not practiced, you've not done anything. So the chance of you crashing is 99% or even 100%, right? Because you have to start figuring everything out at that point. So if you study only content and you don't practice question to know where is your strength, your weakness, all those kind of stuff, right? When you go on the NCLEX exam, it's at the point of you trying to secure your license by passing that exam that you start now getting introduced to the questions, because you will not be like, oh, this question, yeah, I feel like it's testing this content, but I'm still like, don't really understand the question, right? You don't want to have those kind of problem on the NCLEX exam. That's the main reason why you need practice question. So practice question will now help you get stronger related to all the content you have been studying, right? So that's what practice question will do. But a lot of students study practice question the wrong way, in a sense that I don't know why students do like that. It's just like, now take for instance, let us say I study hypertension, I study diabetes, I study COPD. Now when students now want to practice question, they don't practice question related to all this they have studied. Now they start practicing question related to MI, they start practicing question related to asthma, and they don't focus on, like, okay, I'm done with this, let me study question related to this. I'm done with this, let me study question related to this. I'm done with this, let me study question related to this. They practice the opposite question of what they have studied. Right now, when I ask or try to find out why, I notice when they try to study content, because many people try to get question bank, right? Most of the time, some of the question they are going to be answering on the question bank will not test most of those content they have studied. So they have no choice. They follow what it's on the question bank. So it's not matching up. So, but no, we don't want to have a dismatch in our studying. That's the reason why in my own program, when you want to study, you study a particular content and you practice question related to that content. Immediately you can know if you still have problem with that content or not, and you keep practicing till you get it right, because there's no point of going on the NCLEX exam and you are not sure whether you are going to pass or not. You want to go on the you want to go take the NCLEX exam with 100% uh believe or knowing that you are going to work out as a licensed nurse. That is what I want for every student to join my coaching program. Now, we'll be talking about content, but do you know the right content to study? Right, because like I said, every exam, in order to pass the exam, you need what? You need content plus practice question. Now, the truth is this: there are three things that make you pass any exam, right? Three things. One is understanding, right? And this understanding part is very simple. It's just like now, let us say your friend invited you to a particular party, right? And then you did not try to understand the party, and then you dress a certain way to that party. Now you got to the party and you notice that you are the only one that you dress in a particular way. You end up what? Being what? Disappointed. Why? Because you fail to understand what kind of party. Maybe it's a birthday party, maybe it's whatsoever party. Maybe it's a get together party, this and that. Maybe you're supposed to dress in corporate and you did not dress like that. So you end up being disappointed. The same thing happened with the NCLEX. Many students don't understand the NCLEX, so they still prepare the same way they were preparing for nursing school exam. So it means that the party we are talking about now is the NCLEX exam, right? So the dressing we are talking about is how do you prepare, how do you study for the exam. If you don't understand the dress code, you are going to go on the NCLEX exam and be disappointed. You don't want to go on the NCLEX exam when the 85 to 150 question is what decide your career. You don't want to now use that 5 hours to start thinking of how you've disappointed yourself. Instead, you want to remember these 5 hours for the rest of your life, because once you think about it, this 5 hours investment, little 5 hours investment is what open way for your 12-hour shift, right? That start making you a lot of money, that start making you start living the dream you want, that start making you start caring for the patient you've wanted all along, or start making you like plan other things you have for your life. So these 5 hours, we don't want to waste it. We want to make sure that these 5 hours give us our license. And in order to do that, one way, number one way, is to understand the exam. Like I said earlier on, the NCLEX is not trying to test you as a nursing student. It's trying to test you as a nurse. And there are criteria to answer question as a nurse. One, you always need to ask yourself, what is the care that question is testing? When I start answering question now, you will start seeing it. You see, when I'm answering the question, I'm trying to always ask myself, what is the care in this question? Because from that care, that is the way I can know how to carry it out. You understand? It's just like now, if you start working as a nurse now, you will do this thing many of the time. When doctor is trying to discuss situation with the patient, you will always ask the doctor, what do you want me to do for the patient? It's not that you don't know what to do for the patient, but you want to know the specific care the doctor wants you to carry out. Like, you know how to do anything the doctor wants you to do, but you are not just doing anything, because you need to find out what the doctor wants you to do. It's okay. What I want you to do is I want you to elevate the head of the bed of the head of the bed for the patient, and you're like, oh, okay, you know how to do it. But as a nurse, this is the doctor, this is you as a nurse, and this is a client, and you're like, oh, doctor, but the patient was complaining seriously of neck pain after the motor vehicle accident. I don't think that would be a right thing for us to do for the patient right now. Do you think there's any other thing we can do? Now, because you as a nurse find that maybe not to be safe for the client, you see, it's not that the care don't bring the like, it's not that the care will is not going to give the result that the doctor wants, or the result that the patient wants, which is maybe to help the patient to be able to breathe properly, right? But what is making us not carry out that care is because the nurse is finding that not to be safe, because of the motor vehicle accident and the pain the patient is having. So maybe there will be some certain kind of another treatment, or another way of just carrying out that care. Or take for instance, let us say the doctor is like, oh, nurse, I want you to hold on, this. I say, oh, maybe say, nurse, I want you to administer beta blocker, because when I was checking, I saw that the client has 160 over 102 blood pressure. And then you are not like, oh, doctor, yeah, yeah, the patient truly have 160 over 102, but have you forgotten this? The patient have asthma. I say, oh, okay, that's true. The patient have asthma. Oh, no, no, no. We have to give another medication. Now, it's not because beta blocker is not used for elevated blood pressure, but these patients have contraindication that will not make you to give that medication to that client. You see, NCLEX is about the safety. So NCLEX will put nursing information that is correct to you in your question. That is the reason why a lot of students see the question and they say the answers are always correct. Yes, the answers will be correct because NCLEX give you information that are correct. NCLEX exam is not a particular exam that is going to give you something that is wrong, because NCLEX is not trying to test what is wrong. NCLEX is trying to test things that are correct, but are they safe? That is the new um way of answering question, not the way you do it in nursing school whereby you say, oh, this is totally wrong, this is wrong, that is wrong. No, NCLEX question, every answers can be correct, but one will just be the one that is safe for the client. And how do you know which one is safe? If you are the one kind of student that think of nursing information, everything will be correct. If I tell you insulin for diabetes, if I tell you which of the following should the nurse clarify, right? Let's say I'm asking you a particular question. Very interesting, this one. Let's say I'm saying which of the following should the nurse clarify, and I'm saying beta blocker for a client who have hypertension, for hypertension. Okay, let me just give it to you the way the NCLEX always used to put it so that you will understand what I'm saying. Now, the NCLEX can have let me have clear space here. Now the NCLEX can do it like this right now. The NCLEX can give you the patient's information. The NCLEX can say, okay, you are caring for a patient who have 160 over 102 blood pressure, history of asthma, the blood sugar is the glucose level is like 190. Um, yeah, let's say maybe the patient have elevated fever, elevated temperature, I mean, right? And then let's say the patient have pain. The question is not saying which of the following medical order should you question, right? And then one answer now say beta blocker, right? Two one said the antibiotics, the one is like the analgesics, right? And then maybe four the insulin. Right. Then you see students that like to think about nursing information, they will say everything is correct. Do you know why? They will say because the patient is having increased blood pressure, so this should work. The patient is having fever, so this should work. They say the patient is having pain, so this should work. The patient is having increased blood glucose, this should work. So now at this point, they don't know what to clarify because everything seem correct, or not even seem correct, they are correct. So this is what causes a lot of students to be lost, right? The question, because every answer is correct, but the question is testing what should you clarify, meaning there's something here that is very important for you to pay attention to based on the safety of this client, despite the fact all this is correct, that will not make you to give a particular medication here. But if you start thinking as a nurse, then you will say, okay, what will make me not give this beta blocker based on this situation that I'm having right here? Right, based on this situation. There are even two situations right here. One, the asthma, and two, the fact that this patient is having diabetes, because beta blocker one can max the sign of what? Hypoglycemia. And two, the patient is having asthma, beta blocker can also cause bronchospasm. Right? So these are things you need to know. So when you are clarifying now, this is when you will clarify. It's not because of beta blocker can be used for this that you feel it is correct. It's because of it's not safe based on true situation that is um going on here. I hope you understand what I'm saying so far, so good.
Yeah, I do.
All right, great. So that is the NCLEX understanding that you want to understand. One, like if you are following me clearly, you understand that the message I'm trying to pass is that NCLEX want to test you to see if you are a safe nurse
Yes, yeah, sure.
related to certain kind of care. Right. So now the second part, because I talk about understanding, the second part is the content. So now this is where, when you are studying the content now, will not change. Unlike in nursing school, whereby you study related to topic, now your content will not be related to topic, it will be related to care. In nursing, like the both the topic and the care are both nursing content, like I said earlier on. But because you are not preparing for another nursing school exam and you're preparing for the NCLEX exam, your content should be related to care, not related to topic. I am talking about let me raise this real quick. I am talking about the difference between, just like now, somebody had a friend, right, who took the NCLEX exam, and then she was asking this person, "Oh, what did you got tested on the NCLEX exam?" And then this student was said, "Oh, I saw advanced directive on the NCLEX exam." Now, guess what? When you hear advanced directive, what are you going to do immediately? You will go maybe to your textbook, everything like that, and you will start studying everything related to advanced directive. Now, you know that this is what she saw on her exam, but you did not know how it was tested. That's the problem. Now, every content, right, that is in form of topic force you to study nursing information. And nursing information will not be useful or can be dangerous, right, on the NCLEX if you fail to understand the care. So if I was the one that understood NCLEX exam and somebody is telling me advanced directive, I'm going to ask, well, that particular person, how the NCLEX tested that. I don't want to know what you got tested on. I want to know how it was being tested, because it's the how that gets me introduced to the care.
Sure.
But there's still how you can know the care, because NCLEX has given out the content written in form of care. For RN exam, the okay, let me just start by saying this. The NCLEX is built on what we call the 8 client needs. Right, the 8 client needs. The NCLEX is built on the 8 client need. Now, this 8 client need, you can call it 8 client, or you can say 8 categories. The writer of the NCLEX exam, they went into the field of healthcare, right? And they started doing research related to what you will be doing when you start working as a nurse, right? So they had every list of nursing care. So all this list of nursing care, they now broke them down to 8 parts. So now the first part of the care have the first part of this client need, they have different care in it. The second part also have different care in it. The third same thing, the fourth same thing, the fifth same thing, the sixth same thing, the seventh, eighth, they have their care in it. Now, if you see a particular key on the NCLEX exam, let us say the NCLEX is saying you are preparing to administer beta blocker to a client who have hypertension. That key is related to pharmacology, pharmacology client need. If the NCLEX is saying you are caring for clients in labor, that particular care is related to health promotion. Right. From that question, you can tell where the question is coming from, because when you on if from any NCLEX question, you can tell where that care is coming from. If you understand the 8 client need, let me put it in a separate place. The 8 client need give birth to the content. And remember, the content is in form of nursing care, not topic. And the content give birth to the concept. And the concept give birth to your exam question. Now, I've explained the 8 client need. Now, the 8 client need is the category that house the content. It's just like now, let us say these are oranges and these are apple, right? And I'm like saying, okay, this bag is for orange and this bag is for apple, right? So I'm not saying, okay, place this where they should be. Obviously, you are going to pick all this, put it in this bag, pick all this, put it in this bag. So these oranges, this apple, they are the care, and the care you are placing it in the right client need. So we have 8 of those client need, and the NCLEX place those care in the right client need. That is just the whole thing right here. So, but if you understand the client need and you understand the care, it will make sense for you when you are answering the question, because you will be able to understand the mindset of the examiner. Because when you see a particular question, instantly you are predicting the answer already. It's just like now, right? I don't need the NCLEX to provide me option if they tell me a nurse, right, administer wrong medication. If they tell me a nurse administer wrong medication, I don't need the NCLEX to give me any answer before I know what I should do here as a nurse. Because one, I have studied this so many times that I know what the nurse should do first, or what should be the priority action. The priority and first action is one, it can either be if the medication is in form of IV, we need to immediately stop that wrong medication. We need to immediately stop it. If it's something maybe the patient took, maybe PO, IM, any other form, um, we need to assess to see if the client is okay. After, if it is IV, we stop and then we jump straight to assessment. But if it was not IV, then we just do assessment, because the first priority all the time, or the first thing you need to do, is to find out that the client that got that wrong medication is fine. So there's no how, when NCLEX put the question in this format and they give you answers, it will always be this answer: assess, or if it is an IV form, for you to stop it. Except if the NCLEX did not put stop in as part of the answer and put assessment, then assessment will be the answer. It's always like that. So that is how I want you to go on the NCLEX exam. I want you to go on the NCLEX exam in a sense that 90% of your question, you don't even need to even see the answer before you can even say, this is likely what the answer will look like. Or even if you see the answer, at least you can now be able to now see the answer and now say, this is definitely going to be the answer. Right. So yeah, things might when you are studying, you might notice that okay, you are not understanding it immediately, which is definitely fine. But with time, you are going to get the process, because one, you are not just studying randomly, you are studying the right thing. And two, when you study every time the same way, the same method the NCLEX wants you to use, you are going to build that momentum that give you the chance of passing the exam. Right. Are you understanding what I'm saying so far? So good.
Very well.
All right. Awesome. Any question at this point?
No.
No question. All right.
No.
So yes. So I want to make sure that you understand everything, so that when we are answering question, everything is clear.
Oh,
Right.
I do understand.
Okay, awesome. So yeah, that is
I
that for
already watched some of your videos about this.
okay, great. All right, awesome. So yeah, that is that's about it, right? So the content we are going to be studying are related to care. So many students now, their problem is they don't even know uh the content. So it's because they don't know the content, it forces them to start using different kind of question bank, right? It forces them to start using different kind of question bank. Whereas you need to study contents that are related to care, right? That's what you need to be doing. But the problem is many students don't know where to get the content. And NCLEX is not hiding the content, because the content is not what NCLEX is really testing. It's the safety. You being a safe nurse. That's what the NCLEX is testing. So the contents, they are available on the NCLEX website. If you notice, right, earlier on, I said nursing school topic is what? Advanced directive, right? Now, on the NCLEX, it's not written as advanced directive, it's written as integrate advanced directive into the client plan of care. Now, if you look at this and this, you can see they both have advanced directive in it. But this is not telling us what we should do about the advanced directive. But you see, this one is telling us. You see, every NCLEX content will always tell you the care you are going to perform. So when you are going to read this content, there's no how that you are not going to read it in form of care, because it's literally telling you what they want to test. They are trying to tell you They want to test to see how you can integrate this advanced directive into the plan of care. So you are not going to go and be reading more information. Instead, you read the step at which you carry out this care. Simple. The reason why a lot of students struggle on the NCLEX exam is because they read the wrong content. So when they study the wrong content, right, they are studying it in form of nursing information, not care. So when NCLEX tests them in form of care, they don't even know what the answer will look like. They still struggle because they are trying to remember what they study related to that particular content. You don't want to try to remember what you study. You want to know the care, because the care is going to guide you related to what the particular question is testing. So in order to focus on content that are related to care, you need to use the NCLEX content. I was about saying previously before that for the RN, the content is 146. For PN, the content is 152. NCLEX content. Now this content can be more, but the care like related to them, like if you like pick the first one and you study it, right, you look at it and then you study various things under it. The second one, study, there's a particular content that talk about you should know about acute condition and chronic condition. Now you will notice that this particular care will be a lot, because now you need to start knowing different condition related to each body system. So even if it's 146 different kind of care NCLEX want you to know that they will test, when you start studying them one after the other, it can be more. Right. So that is that. So the last thing that make you pass any exam is your practice question. And I gave you a good explanation related to why you need practice question. One, you want to study a particular content and make sure that the question you are practicing is related to that content. You don't want to study a particular content and study another question. You want to make sure that you study every question to master that content. And that's what I do best, because when I teach you a particular content, right, I don't just give you question and I say, okay, that is it. Maybe you come out with 9/10 or you come out with 7/10 for that particular content. I make sure you master the content, not only by your score, but by what you say to me, but by also how you interpret the question. So that when you go on the NCLEX exam, I will be so confident that you will walk out as a licensed nurse, even if you are not even confident in yourself. Because yeah, there's no point of investing so much to pass the NCLEX exam, you walk in and then you fail, right? So before you even decide to fail, right, um you cannot even decide to fail in my program. You can only just give up on study, because I will make sure that you do what you need to do in order to pass the exam. Except if you don't like becoming a nurse again, that's just what can stop you from getting the desired result, which is passing. You will definitely be able to pass, right? So the practice question, we don't study random question. We make sure that we study questions that are related to how the NCLEX test it. Most especially in my program, I let students know how the NCLEX write the question, because the NCLEX wants students to know that how they write the question. Like I said, it all starts from the 8 client need, followed by the content, then the concept. Right. So when they decide which client need to test, they pick a particular content, they use concepts. For any care, there are 6 ways you can carry any care in nursing. Even if the doctor is saying, "Oh, I want you to do so and so," it will be one of these 6 ways that you're going to carry out to that care. Right. Um the moment your patient is having, you access your patient, you check your patient vital sign and you notice that your patient is having blood pressure of 90/50, right? And then you now decide to inform the healthcare provider. You've carried out one of the concepts, because one of the concepts is called communication and documentation. So the moment you call the healthcare provider, you've done one of the concepts, which is communication. There are some certain care that will require you to use communication to solve the problem. There are some certain care that will require documentation to solve the situation or to carry out that care. There are some certain care that will involve you to just be caring to your client. What NCLEX describe as caring is interaction to solve client problem, and interaction is more of your therapeutic communication just to solve the problem. We have 6. We have concept of caring, we have concept of nursing process, we have concept of clinical judgment, we have concept of communication and documentation, we have concept of culture and spirituality, and then we have concept of teaching and learning. So there are some certain care that you will carry out just by teaching the client about their condition. That's a form of care, teaching them, right? So it might be you just need to do therapeutic communication. It might be you have to use nursing process to care for the client. It might be the question need more of your critical thinking, so you need clinical judgment to solve that kind of question. Some question might just involve you using communication or documentation. So it might just be you respecting the client's culture and spiritual life. Now, the more you understand the concept, the more you start sensing the kind of answer the NCLEX is looking for in that particular question. Now, last thing I'm going to say, right, is this NCLEX. Like, if you have used different question bank, you will notice that there's not a stable way they write the question, but NCLEX have a stable way of writing the question. NCLEX like you use the word D and A. Now, anybody that the NCLEX attach A to, it means that this is a person that is receiving the care. But anybody the NCLEX attached D to, it means that this is the person that is carrying out the care. So this is very important because most of the time you want to know who is having the problem. Because sometimes many students always used to think it's always the patient or the client that is having the problem. Sometimes it might be the nurse that is having the problem. Because when the NCLEX say a nurse, it means that because we said A means the person that is carrying that needs the care, then it automatically means the nurse needs the care. But if the NCLEX say the nurse, it means that it's the nurse that is carrying out a specific care or anything or doing something in that particular question. So you want to know who is the one in charge. Also, right, I'm trying to rush all these things, right, because of you said your exam is soon. Normally I break all these things. Right. So also like there are things you need to know in the nursing side. The NCLEX is not a medical doctor exam, right? It's a nursing exam. So you need to always remember that you are selecting answers that fall within your scope of practice, because everything NCLEX is going to be testing you will be related to healthcare, most especially related to different units, facility, So, and you cannot take away what medical doctor will do from healthcare, because you will actually carry out medical doctor orders. But there are some certain things that are not within your scope of practice, like maybe a particular question is saying you should mark the surgical site, right?
Mhm.
This can be correct based on the fact that the patient is scheduled for surgery, but it's not within your scope of practice. We know that before surgery, the surgical site need to be marked. It is true based on the surgery that the patient is scheduled for. But if the NCLEX is saying what should the nurse do and you are selecting this as your answer, you will fail the question because it's not within your scope of practice. It
Okay.
is correct. That's what I wish you to tell students. Right. NCLEX answers are correct, but NCLEX is trying to test to see are you a safe nurse? And safe nurse is not about because when you ask many students what is the definition of being a safe nurse, they will say the ability not to kill a client. No, safe nurse don't mean a client, somebody is dying. Safe nurse just mean that you are following the safe nursing practice. And safe nursing practice is you should know that you are a nurse and not a doctor. So why would you say you are going to mark the surgical site? Because if you select this particular answer, it means that you are saying that you are a doctor now and you want to carry out that surgery because it's not within the scope of practice. So always watch out for the kind of answers you are selecting. Like it's just like now, related to advanced directive. Related to advanced directive now, right? Advanced directive, NCLEX cannot say obtain DNR for the client. But you now will not say, oh, it is true that if the client wants an advanced directive, right, at one point we need to obtain it for the client. But who is obtaining it? It's not you, the nurse. It's the healthcare provider, not you. Or they are saying notarize the document, or the advance directive document. Yes, we know the document need to be notarized because those are nursing information. We learned that the document need to be notarized. An advance directive need to be obtained for the client. We learned it, but now on the NCLEX is not test on the NCLEX is not testing the information now. NCLEX is testing how you now carry out the care. Do you know what you need to do, and do you know what you don't need to do? So even if in nursing school you learned that the document needs to be notarized, on the NCLEX you are a nurse and you are not in charge of notarizing the document. It's the legal team that is in charge of notarizing the document. So if you select this particular answer, even if it was true in nursing school, you will fail it on the NCLEX exam because it's not within your scope of practice. One content on the NCLEX exam say you should carry out every care within your scope of practice. Also, be aware that from your own end of nursing, right, you are going to see the charge nurse, you are going to see you, the nurse in the question, and you're going to see staff member. Staff member can include the another RN, LPN, and UAP. So before you even go on the NCLEX exam, you need to know the role of the charge nurse, your role as a nurse, and other staff member as well too. Right. So if the NCLEX is putting charge nurse in that question, it means the NCLEX wants you to think about everything the charge nurse used to do so that you can understand when the NCLEX say the charge nurse is doing this, the charge nurse is doing that, you'll be able to understand why the question is talking about um the charge nurse doing that, and you'll be able to understand that care. The answer now become predictable to you. As well to the nurse, you need to understand as well to you. As a nurse, you carry out the care as well too. Now, staff member, when the NCLEX is talking about staff member, right, it means that somehow you are trying to do something related to the staff member, right? Maybe you are observing the staff member doing something, monitoring, delegating, making sure they prioritize something. Just know all those kind of stuff. But you need to be aware of what each of the staff member can do, and also be aware that as um as a nurse, you work alongside with other healthcare team members as well too. So every of those team members, you need to know their role. Occupational therapists, respiratory therapists. I mean, your phys- uh, physical therapists, your medical, um, the healthcare provider, right? Your speech therapist, all these kind of people, right? You need to know their role because NCLEX can just tell you which of the following should you recommend for occupational therapist, and they will give you 4 different patient problem. Now, if you don't understand what occupational therapists used to do, how would you be able to know the problem at which the occupational therapist can handle? Right. So these are things you need to know. Right. So always know that sometimes in your question, you are dealing with a lot of people. Sometimes the question might make you deal with the client. Sometimes the question might make you deal with the family member. You always want to know who are you like carrying out the care with at that point. Because sometimes they might say you are caring for a client which the client's spouse. So it means that it's the spouse and the nurse that is having um interaction at that point. Right, the client is just in between. So let's find out what is the problem with the spouse that we need to solve. So the answer is going to make sense. Right. So many students will go on the NCLEX exam and say, "Oh, I saw different medical condition." That's not true. Not all the time NCLEX test medical condition. It's normal to describe patient based on their condition, right? Sometimes the NCLEX can say, "Oh, a patient have stroke," and then the question is not even testing related to stroke. They only just describe the stroke. It might be a different thing the NCLEX is testing. So that's the reason why you always want to pay attention to the care. It's students that pay attention to nursing information that see every medical condition and they will start screaming after they return back from the exam and say, "Oh, my question was full of a lot of medical condition," and medical condition on the exam is not even up to 9%. So where are you getting your question being tested on medical condition? And when you ask them, it's because they only saw it. The truth is you will see medical condition, but not all the time NCLEX is testing that medical condition. So don't always think about the medical condition. Pay attention to obviously, if you are the kind of person that don't pay attention to nursing information and you pay attention to the care, you as well will start saying that, oh, the question is not even testing the medical condition, it's testing this, it's testing that. Right. So yeah, that's pretty much it. I hope I'm not missing any information. With that being said, I'll walk you through questions now.
Yeah.
Right. So now you can see this question on my screen, right?
Yes.
Okay, so every NCLEX question is written in three parts. Right. We have the body of the question, we have the stem of the question, and then we have our answers. Now, what the NCLEX wants you to do is to understand what the question is testing, what the examiner is asking, and what each answers are saying. If you cannot interpret question this way, trust me, you will not understand that question very well. You will struggle with it. Now, you want to understand what the question is testing. How would you know from the body of the question? What the examiner is asking from the stem, what each answer is saying. You need to understand. Now, what each answers are saying related to the stem, the body. So when you check the answer, you are like, okay, first stage of labor who has oral temperature. So it means that the answer is trying to tell us about this client situation. What are we dealing with? Okay, client in labor. Why is the answer mentioning oral temperature based on client in labor? Oh, during labor, if we try to deliver the baby when there's infection, it can be a problem. So, is there any infection here? Yes, no. You think about it. Now you say, okay, contraction occurring every 30 minutes. Why is the question talking about contraction? Oh, the client is in labor, so contraction used to happen during labor. Okay. So why is it saying occurring every 30 seconds? Oh, they are trying to see if it is a safe um um contraction or not. Okay, so is this safe based on how much is happening? Say yes, no, you figure it out. Now you say, oh, this question is talking about respiration of 26. And you're like, okay, why is the NCLEX talking about respiration? Because the client is in labor. So what situation can cause a client respiration to be high like this during labor? You say, oh, okay, this is why. Oh, okay, is this good? Yes or no? You figure it out. Right. You say, okay, another contraction again. Oh, they're trying to see if it is safe as well, too. Okay. During labor, you figure it out. That is how you think about the question. But if you are thinking about this respiration based on nursing information, the only thing that will make sense to you about this respiration is that it's always 12 to 20. So now when you think about it, you will say this is high. And then when you think about respiration, you are already thinking about respiration problem, all that kind of stuff. And then when you think about that, this logically be your correct answer because many students, the only best approach to answering question is ABC. Whereas ABC is an approach when you have discovered that that care need you to use that approach. It's just like I talk about those six concepts, right? We have caring, nursing process, clinical judgment. Part of clinical judgment is applying this. So, but why are you going to apply something when the question don't need that particular thing? It make no sense. It's just like patient don't need a particular don't need the way of like the way you want to carry out that care. The patient don't need it, but you are applying it. It's just like right now. I returned from the gym. I'm very tired. My respiratory rate is 26 because I returned from the gym or I returned from jogging. Right. And then my respiratory rate is 26. And then because you are a nurse, you are applying ABC and you are saying, oh, my respiratory rate is high. I need admission. I don't need admission. All what I just need is to rest. Once I rest, my respiratory rate is going to come back to normal. Because my respiratory rate is high, does not mean I am sick. But if you pay attention to what is causing the respiratory rate to be high, you will realize, oh, he just returned back from the gym. He just returned back from jogging. So give him time. When he rests, his respiratory is going to drop back to normal. Simple. So understanding the care make you interpret the nursing information because these are all nursing information. The nursing information can be good to you, the nursing information can be bad to you, but the nursing information can only be good when it is good related to that care. The nursing information can only be bad when it is bad related to that care. You understand? Patient
Mhm.
temperature can be high when they return from surgery. If it's within 24 to 48 hours, this patient is fine. But guess what? When students hear that a patient temperature is high when they return from surgery, instantly they start thinking about infection. But the care state that a patient who return from surgery 24 to 48 hours, it's inflammation, not
Okay.
infection. So It's only after 72 hours, if the temperature is still high, that's when we start thinking about infection. But because students don't realize, don't know the care, they tend to think, oh, it's a problem. But it's not a problem because it's within a safe range. Right. Now they
Yeah.
also said a baby who have like bluish discoloration within the first 24 hours of life is not bad. It's good, right?
Mhm.
It's good, it's not bad. But guess what? When a particular student see that, oh, the baby is having bluish discoloration, what did they think immediately? They say, oh, that's cyanosis. Yes, it is cyanosis, but it's a cyanosis that is good based on the timing, based on the situation, based on the care. It's not bad. If it's more than that, then we cannot say, oh, it's a problem. But when it's within that time frame, it's good. So you don't just want to see to what is bad, you want to see, is it bad related to that care? You don't just want to see what is good, you want to see, is it good related to that care? Like I gave you previously before, what is good? I said beta blocker is used for a client to have hypertension, most especially if they tell you the patient blood pressure is 160 over 102 or lesser or more, I don't know, any value that is higher than normal range. But
Yeah.
it is good based on that information. But if I attach that this patient is having asthma, it's going to be bad. You see, it's a good intervention, but it's bad for that client because beta blocker is contraindicated to asthma. Right. So you can have something that is bad and it can also be good based on that client situation. Like take for instance, respiratory rate that is high. During labor, there's what we call high physical activity, right?
Mhm.
uh you are trying to push in a particular stage, you are trying to push so hard using your strength, so you are breathing so hard, you are exhausted, you are this and that, your respiratory rate will be high. So does that mean you are sick? No, you are not sick, because after the delivery you everything is going to return back to normal. So when you see respiratory rate as high, before jumping into conclusion and saying it's bad, look at the situation. Why is it happening? In this case, it's because of the client is in labor. So this is not bad.
Okay.
We have temperature here. The normal range is 97 to 100.4. So this is not bad because it's within range. Now we have two contraction. Now, if you've been studying everything related to labor, you'll find out that contraction is being measured in two ways, right? We
Mhm.
have it being measured related to frequency and it's being measured related to
Duration.
duration. So frequency, NCLEX did not put it here. Duration, NCLEX did not put it here, but there's a keyword that describes frequency, duration, right? Every, right, means frequency. Frequency, how often? Lasting means there's a period at which it should start and stop. That's duration. It's just like duration. You say, okay, for each duration of your class, how long does it last? You say, oh, it's 2 hours per class. You say, okay, that's the duration. So if you start the class now, in the next 2 hours, you should stop. Frequency is how often do you have class? You'll be like, oh, in a day, we have class like 8 times in a day. You see? So
Yeah.
that is frequency and that's duration. So every, you understand? How often do you go to school? You say, "Oh, I go to school every day," right? That's the frequency. Duration is okay. How long does each of your class last each day? You say, we can start by 8 a.m. in the morning and then we close by 3 p.m. That's the duration, right? So lasting means duration, right? And every means what? Frequency. Now,
Frequency.
the next part is now knowing the range. The
Mhm.
range is right. There's a way you can know the range that it might be difficult for you, but based on my knowledge, I have shortcut the process. So, in order to answer frequency, just think about 2 to 30 minutes, right?
Okay.
For duration, just think about 30 to 90 seconds. So you'll find that this one fall within range. So this is not bad, but this is outside the range because this is 30 seconds and we are talking
Yeah.
about 2 to 30 minutes. So
2 to
this now
30
become
minutes. Yeah.
the red flag. Right. So, but I jump into the answer, right? For you to
Yeah.
understand the answer. Now, let's now go back to the question. How do you understand the care? Because one, I said you need to know what the question is testing. You need to know what the examiner is asking. Let's let it make sense now. So, who is in this question? We have the charge nurse. Pick your keyword. The charge nurse. What's the charge nurse doing? Receiving change of shift report. who are the client involved, client in labor. Now, so with your question, we have who is carrying out the care, what we are doing, and the client. Sometimes they will describe the client based on the unit, facility, and all that kind of stuff. Now, if there's a unit, facility attached to that question, it means that the care you will be carrying out will be related to that unit. But if there's no unit, it means that you will think about general care. Like now, if I tell you we are in the pediatric unit and I'm telling you that a patient have a respiratory rate, let's say neonate, right, who have respiratory rate of 33, would you say this is bad? No, because this unit is telling us the kind of care we are going to be thinking of. And when we think about pediatric, most especially the neonate, their respiratory rate is 30 to 60. So this is not bad. But if the NCLEX did not give us the unit and they just tell us the patient is having respiratory rate 33, obviously we are going to start thinking about general care. And when we think about general care, we assume that patient is an adult. So we start using 12 to 20. So this is going to now be a problem, something we need to look into. So the unit describe the kind of care. If the NCLEX say we are in a rehabilitation facility, guess what? Immediately, as a nurse, you need to start thinking, what are the care we carry out when you are in a rehabilitation facility? So
Okay.
imagine the NCLEX is saying the patient have stroke, admitted to rehabilitation facility. This rehabilitation facility don't do care in med surg. So why will a particular student now start saying, "Oh no, the question tests me on stroke," because the question will not test you on stroke. Instead, it will test you related to rehabilitation that you carry out for clients who have problem that occurred or damages that occur related to stroke, like paralysis, difficulty speaking, all that kind of stuff. That is what the rehabilitation facility is going to be dealing with, not situations that have to do with medical and surgical problem, because the medical and surgical problem is the stroke. So when the facility is telling you, when the NCLEX is giving you the facility, it make you think about the kind of care you will carry out, right? So yeah, so that's pretty much that. So now we have these three things, the charge notes. Now you start thinking, oh, we have the charge notes. What's the charge notes doing? Receiving change of shift report. Now, this is the key right here. When somebody is receiving change of shift report, the next thing that you want to do after receiving change of shift report is to start seeing the client one after the other and assessing them to see your priority for the day. Like as a nurse now, when you get your report and then you are like, okay, these are your clients. You don't just say, okay, I will start with this client. Let's say maybe they assign 4 clients to you now. You don't just say, oh, I will start with this client before this client, before this client. No, you will assess this client, assess this client, assess this client, assess this client. Or obviously, when you go, paid attention to the report. Obviously, the report will tell you about this client situation, this client situation, this client situation, this client situation. So based on the report, you will not start saying, this is the client that is having the most serious situation right now. So this is the client I'm going to see now. Right. So when you receive change of shift report, right, the next thing is to prioritize your client. So even if the examiner is not saying you should see somebody first, you as a nurse that you understand the care, you already know what the examiner is going to ask you. That's what I always used to tell my student. The moment you understand the care in that question, you don't need the examiner question again. The
Okay.
question you are going to be able, you are going to know the question by yourself once you understand the care. Because after change of shift report, it's to see your client. What are you doing? Are you going to sit down to eat, take break or something? No, you are going to see client. But based on this question is the charge nurse. So the charge nurse most times don't always see clients, right? She more would delegate and make you prioritize,
Okay.
right? So because of she's the charge nurse, that is the reason why this question can either be related to delegation or prioritization. So that's why when you look at the examiner question, this question is all about what? Prioritization. So when you think about prioritization now, you don't just jump into conclusion, because when you ask many students, what is prioritization all about? They will say prioritization is to see client first, but prioritization is not all the time to see client first, because we have three type of prioritization in nursing. I'm going to put them on the screen right now. You need to understand which kind of prioritization you are doing. One is related to client. That is when students will say, "Oh, are you good with prioritization?" Yes, I know how to see client first. I know which client to see first. No, the moment you tell student prioritization, the first thing they think of is, "Who are you going to see first?" As the kind of question, then they don't really understand prioritization. One prioritization is related to client. One prioritization is related to tax and procedure, and the last one is related to findings. The NCLEX can tell you which of the following findings should the nurse, which of the following findings require immediate attention, immediate intervention, right? That's prioritization, but it's related to findings. So the NCLEX will give you 4 findings, and you have to prioritize which one is dangerous. Right, it can be related to tax and procedure. The NCLEX might say, the nurses, each of these patients have this particular test to be done. Which one would you do first? Maybe you will not say, "Oh, this patient needs to carry out ABG based on the having respiratory problem." You say, "Ah, this ABG is very important. Let's do it." Right? Or they say, "Oh, patient is showing sign of stroke and they require CT scan." You say, "Oh, okay, maybe it's this one that will be priority," something like that. So that's how the tax prioritization work, right? Or maybe they might give you different intervention, and they might say, "Okay, the client is having this particular problem. Let's say the client is having pain, the client is having infection, and they're asking you to prioritize, and they put antibiotics, they put analgesics. Obviously, the antibiotics will be your priority because infection is bigger priority than the pain, right? So but pain also have their level of priority as well too, because there are some certain pain. It's just like if I tell you a patient is having chest pain, and I tell you a patient is having pain from fracture pain, guess what? Which one is more of your priority? Obviously, it's the chest pain, because the
Yeah.
chest pain might be related to MI, but fracture pain, that patient pain, that patient in that particular kind of pain can wait. We need to see that client with chest pain first, right? Because the chest pain is all maybe probably indicating MI, which we don't know. So with pain, pain, infection, bleeding, you need to be careful when you're trying to prioritize them. You need to understand, where's the infection coming from, what kind of infection, pain, what kind of pain, bleeding, what kind of bleeding. Because they tell you patient is heavily bleeding, don't mean is a priority. You need to understand what kind of bleeding. If the bleeding is related to menstrual cycle, it might not be priority, because heavy bleeding mostly occur. The only time this is going to be a priority is if it's dropping the blood pressure reading. Right. So there are more to all this, but obviously I cannot even cover it today, because yeah, nothing is pretty much a lot, right? And it's not what I can cover in just maybe 2 hours, 1 hour or so. But I'm just giving you an idea so that you understand when you are studying,
Okay.
it will be a different way for you now, right? When you are trying to pay attention. So now we understand its priority. We apply the one that we need to apply. In this situation, it's related to client, because obviously the question has even stated it right here. That is client. So we apply client prioritization principle. So we have principles when it comes to prioritization of client. There are principles we look at. One, we tend to look at the client condition. We tend to look at the client situation. There's difference between situation and condition. Condition can be medical condition or surgical condition. For example, they say, "Oh, a client who have COPD having shortness of breath." The condition is COPD. The
Okay.
situation is they have shortness of breath. When you are trying to prioritize, you don't use the condition to prioritize, you use the situation. The condition is like a reference to why that thing is happening. You see, when I was thinking about this, I referenced to this. When I was thinking about this, I referenced to this. When I was thinking about this, I referenced to this. If I did not reference all this to this, I would have selected 3 as my answer, because there will not be any logical reason why I will leave a client who is having increased respiratory rate when I know respiration, respiratory system is very important and can lead to death. But because of I attached this to labor, I was able to realize that, oh, during labor there's high physical activity which cause exhaustion, increased respiratory rate. More of the reason why we teach the mother deep breathing techniques. So it's very important to know that this is not a problem. You see, so now they can tell you a patient is having a particular situation, right? If you don't reference it, you might not really know if it's important or not. Like now, if I tell you a patient who have COPD is having temperature of 104, and I tell you a patient who is a patient with pneumonia, right, is also having the same temperature 104. Who are you going to prioritize? Let me ask you this question: who are you going to prioritize based on those two client situations? The patient is having
Um,
COPD 104, pneumonia 104. They have the same temperature value. So who are you going to prioritize?
the pneumonia.
Why is it pneumonia?
Because in COPD, I think it's expected. Or
Okay. I'll walk you
is it temperature 104? Is it the temperature?
yeah, temperature. I'll walk you through it so that you can critically think
And
about
the
it. What is
104
COPD?
congestive a chronic obstructive pulmonary disease.
All right. You gave me the full meaning of
And
COPD.
please,
I'm not asking
the
for the full meaning.
104, is it in Fahrenheit?
Yes.
I'm usually I'm used to the degree Celsius.
Oh, degree Celsius. But it's English will give you the two though. English will give
So 104. How much is that
But
in degree?
even if you are used to degree Celsius and you know degree Celsius, you will know this is high already because it's even way high. Because
Yeah,
the degree Celsius is
37.
between the 30s.
Yeah,
The
37,
Fahrenheit is within the 90s.
90s. Okay.
So anything that you are not seeing 40, you know it's a problem. Anything that you are seeing 100, you know it's most likely a problem. But Fahrenheit is 97 to 100.4. So now these two temperature they are high, but one is coming from a client who have COPD and one is coming from a client who have pneumonia. So I'm asking you now, who is your priority? And you said the client with COPD. So now I want to walk you through it so that at least you will be able to understand it yourself. Because I don't need to tell you the answer. I want you to understand the answer. Right. So now, what is COPD? When I say what is COPD, I'm not saying you should give me the full meaning. What is COPD?
It's a cardiac disease or
COPD is not a cardiac disease. What is
congestive
COPD?
pulmonary disease. It's a respiratory condition.
Okay, it's a respiratory condition. Why do you say it's a cardiac problem? Why do you say it's a cardiac problem?
These letters will spell a word you see very often when you read. The word is it's a respiratory condition.
For every disease, you need to know the definition for that disease.
Mm-hmm.
Pathophysiology, this is not me telling you, this is what the NCLEX examiner wants you to know. You need to know the definition, the pathophysiology, and the disease process.
Yeah.
Like the reason why a lot of students struggle with prioritization is because they don't even know the disease process to every condition.
Yeah.
It's just like now, if I put two problem right now, or four problem, the ability to prioritize based on that problem is how you understand the disease process. Like
Mm-hmm.
now, when you look at the disease process of this guy, you'll be able to tell, okay, before this patient will die, this patient need to get to this stage, get to this stage, get to this stage. So this patient maybe have more time. Now, maybe this patient just need to get here and then they will die. Maybe this one need more as well. Maybe this one need more. So based on you understanding the disease process, you don't need any strategy. You
Okay.
don't need any strategy. You instantly just know that this is the patient that is closer to dying, and then you select that. The ability to prioritize is when you understand the disease process, nothing more. I don't even teach student strategy. I can give you shortcut that can help the process of selecting the answer faster, but you need to know the clear way to answer. Let's not deceive ourselves here. Strategy comes from understanding. Once you don't understand, it's not possible to answer the question. Like you are a
Okay.
nurse, you need to have a level of understanding to apply a particular strategy. If I give the same strategy that you will use to answer a particular question as a student nurse to a police officer, no matter how you explain that strategy, the police officer will not be able to answer the question because they don't have the full understanding of nursing. But if I give that strategy to you that understand nursing, you will be able to utilize the strategy because you are used to the nursing information. So strategy come from understanding. So when you watch people video on YouTube, Instagram, TikTok, whatsoever place, and then you see how it's interesting for them to, you see how interesting it is when they are answering questions, what they are applying. That strategy don't come from magic. It comes from a nursing knowledge. It comes from a nursing content. Strategy, what I explain strategy to be, I always used to tell my students that strategy is a way of me explaining something in a way that your brain see it as something that is interesting. Right. And your brain capture it that way. We walk through the strategy related to that question, and we're able to get the answer. It's very interesting. You love it, you want it. Right. Now, there are some certain people that when they are trying to answer question, because of the way they have complicated the question in their mind, we need to like use a particular way of making that question make sense to them. Like now, if I tell you which of these patients should you place in a private room, you will be thinking about a lot of things immediately because you want to make sure you get that question right. But what if I tell you, in order to place one of these patients into a private room, use this principle AIDC, airborne immunocompromised droplet contact. This is the first priority, second priority, third, fourth. Now, you are not going to think about too many things again. Now you will be thinking of applying this related to this question. So I've helped you to shortcut the process. So instead of thinking up and down, right? Now you have a clear way of answering the question. So some people don't have a clear way of answering question. All we just need to just do is, do you have the nursing information? Yes. Do you know how to answer the question? Maybe. So now this is now what we are going to use to solve that problem for you. Because even if I tell you, in order to prioritize patient to a private room, right, you need to use the AIDC principle. If you don't know that chickenpox is under airborne, there's no how I can help you, because that is a nursing information you need to know. Right. So even if I teach you something about medical condition and you go on the exam and you make mistake and you say COPD is a cardiovascular problem, then there's no how I'm going to save you, because this is your own part, knowing the information. My own part is to make sure that I give you the nursing care related to that information and how to go about answering those kind of questions. But if you make mistake on your own part of the nursing information, there's no how I can help you. I can tell you this is how to answer a particular question, but if the nursing information that you need to know is missing, then there's no how. If we are saying we should prioritize patients, they gave us chickenpox, they gave us pneumonia, they gave us patients with scabies, they gave us another patient with maybe with what's this condition again? Hepatitis B. We have chickenpox, we have pneumonia, we have scabies, we have hepatitis B. And this is the principle. This principle will be looking at you if you don't know if chickenpox fall under airborne. If you don't know if pneumonia fall under droplet, if you don't know if scabies fall under contact, and if you don't know if hepatitis B fall under your standard precaution. So that's why if you check through many of my teaching, you will see the care is very important. How to carry out the care is very important, which I've given it to you. How to carry out this care that NCLEX is testing you. But the nursing information is what we now give you the ability to now carry out that care well. Because if you don't know the information, then the care is just going to be staring at you.
Sure.
The problem is a lot of people have crammed, memorized all this nursing information, which is good. But now, if I can help you add how to carry out the care, then it should be perfect. Then you should walk in to your exam center and walk out as a licensed nurse, not defeated. Right? So that question I gave to you, COPD, pneumonia. COPD is a respiratory problem. Pneumonia as well too is a respiratory problem. But COPD is related to chronic emphysema and chronic bronchitis. Pneumonia is inflammation of the air sac, right? Now, these two different conditions affect the way you breathe, your oxygen, all kind of stuff, right? But based on the understanding of pneumonia, right? Why does pneumonia occur, right? Now, this is the pathophysiology. Based on the understanding of COPD, is because of the inflammation, right? That used to occur, right? Now, the inflammation and the inflammation, right? Now, the pneumonia, what is happening is infection. It's infection that is affecting the air sac. It's inflammation that is affecting the bronchitis and causing and also the chronic emphysema. The that's like our exchange of gases as well too. So that is two problems that is occurring when it comes to COPD, and one that is occurring which is infection. Now they are not telling you a patient who have COPD is having increased temperature, and they are telling you a patient who have pneumonia is having increased temperature. Who is expected to have increased temperature in the two? Pneumonia, because pneumonia is naturally an infection. With every infection, the way you know a patient is having infection is through their temperature. It's just like, how do you know a patient is having hypertension? Is when you check their blood pressure. How do you know if a patient is having infection? It's when you assess their temperature. Right. So pneumonia is not an infection. So you need to be more surprised. Why are they saying the patient is having 104? Because it's not expected. If it is pneumonia, yes, we can say yes, it's expected because obviously it's an infection. If they tell you a patient is having diabetes and is having blood pressure of 160 over 102, you should be shocked, because why is a patient who have diabetes having increased blood pressure? Because it's not expected. We are thinking of the blood glucose, not the blood pressure. But if they tell us a patient is having hypertension and they're having this value, we expected because it's aligned with their condition. So if they tell you who are you going to prioritize based on these two, you more want to prioritize the diabetes. Why? Because this is an unexpected situation. That is how you think. So now when we see COPD, pneumonia, we know pneumonia is expected. COPD become your priority because it's unexpected.
Okay.
Am I making sense?
Yes.
All right, great. So far so good. Based on the little conversation we have been having, so far so good. I feel like I don't know, right? Because you cannot judge from just one mistake or something like that. But the way you like try to answer the question, I pay attention to a lot of things. One, how long is it taking you to respond to the answer? What did you say, and how are you critically thinking about what you have said? So far so good. I might say based on just this session that you have content uh problem. I've not got to see how you answer question, but yeah, content issue. Right. So you need to work on that though, so that you have a good chance of passing the exam. And also when you are practicing question, practice question related to the NCLEX past question. This is the NCLEX past question that we are doing right now. If you can succeed there, you will succeed on the exam. I can 100% guarantee you that. So make sure that when you're practicing question, focus on the NCLEX past question. When you are good with NCLEX past question, you can now go study different third party. That's up to you. But in my program, I use more of the NCLEX past question. I don't use third party question. Not that I discourage it, but I feel like you don't need too many questions in order to pass the exam. Once you are doing everything right, you don't need 1,000 questions to pass. You just need the right question to pass. And the right question, you don't need it too much. You just need to understand how to answer each question. Right. People will say, oh, if you practice more questions, you get to see those questions that you've practiced on the exam to pass. Yeah, it can be true for some people, it might not be true for some people, but the real way to pass the exam is not too many questions. It's by focusing on the right question. Right. By focusing on the right question. One way I wish to tell students this is, you can drive different kind of car, right? You can drive you can say, oh, I've driven 12 different kind of car. Now if you are to drive a big uh car, big like trailer or lorry like this, the way you were driving all those smaller car will not be the same way you're going to drive this one, because you now need to be measuring the distance at which you are going to turn. You are going to do it's not the same feeling as this. So because of you've driven 12 different kind of car, don't mean you can now be able to drive this big trailer. Right. So that is it. So because you've practiced thousands of questions don't mean you can be able to pass the exam. I've seen somebody who failed the exam 7 times and I said, okay, it's just like how I asked you, what program have you used in the past? You told me. Now this student told me she used 7 different programs. Let us say she have 2,000 questions per each of these programs. So multiply 7 times 2,000, that is 14,000 questions. So 14,000 questions she have practiced did not help her to pass just 85 to 150 questions. And somebody will sit down in their comfort zone, in their room, on Zoom, and tell me they need more questions in order to succeed. I've seen people that fail the exam 10 times, 12 times, 14 times, 3 times, 4 times, 5 times. If it is question, those people would have passed because the many students, once they use a particular program now and they did not pass, they are not ready to use that program again. They are ready to change it. But I wish you to tell students this: it's not program that make you pass. It is your approach and your understanding, right, that make you pass. It's just like right now, somebody got hypertension in the US, and then the person is not saying, oh, it's because I was in the US, I got hypertension and relocated to Canada. Guess what? You see that hypertension is also going to follow that person to Canada. So it's not the location, right? Because the US is like your question bank one, you use and you fail. The Canada is your question bank two, you use. So, but the problem is still following you because the problem is what you are not fixing. The hypertension is still there. It's not the location that is giving you the hypertension. It's you that caused the hypertension on yourself. It's your body that caused it, not the location. So, no matter how you keep changing location, if you move from US to Canada, Canada to Australia, their hypertension will be following. So, if you are moving from one question bank to another question bank and you are not fixing the problem, you will still keep failing. That's the truth. You will still keep failing. I hope you learn a lot from this little session, and I hope I'm able to add impact to the little to whatsoever you've been doing before, and can give you a better picture of how you can approach the NCLEX exam.
Yeah,
Right.
sure.
All right. So with that being said, I will open the room now for you to ask question. You can ask me any question you want to ask me now.
Okay, I'll ask you about the NCLEX.
Okay.
Do we have specific content that they always ask, or it's like you wouldn't know the type of content that they ask, but just learn and then go. You see, there are some specific topics, just like the case studies. You definitely get case studies. Maybe you get
Yes.
priority questions. You get safety and infection control questions.
Yeah.
The yes, I want to know about that.
Yes, there are specific content that every nurses will answer, right? For sure, like case study, 100%. Your bow tie question for sure, your chat question for sure, your infection control for sure, your management, like you are going to get questions from every category. But the truth is that you cannot know the way the NCLEX, which part of those categories will be tested because it depends on individual exam, right? So NCLEX might see to your level of understanding and test a specific content based on your understanding. So it's not based on what the NCLEX feel like everybody should know. It's based on what the NCLEX feel like you know.
Okay.
So that's the reason why there's no specific content that somebody can say, oh, you will see on the exam. There are some people that go on the exam today and they got ECG, right? And there are some people that also took the exam and they did not see ECG. So if I tell you ECG is part of the NCLEX tested content, yes, it is part of the NCLEX content, but would you see it on your exam? No, it depends on what you show to the exam. But the NCLEX content that the NCLEX put on their websites, the NCLEX cannot test anything more than that. It's always that content. So if you study all those 146 contents, I can 100% guarantee you your question is coming out from there. Even if we are not sure of where the question will come out from, I can 100% guarantee your question is going to come out from this 146 content. So when you study it, you have no chance of failing the exam. So you don't even need to be worried about what content that will be tested. Instead, you will be worried more of how do you cover this so that when you go on the NCLEX exam, you are able to cover everything or you are able to answer every question the NCLEX will test you. So
Okay.
that's it. Yeah.
Okay.
Any
So
other question?
with the 146 content, how am I supposed to learn all?
How are you going to learn all?
Mm-hmm.
Yeah, the answer is obvious. When you join the coaching program, I have every explanation to each of these contents. But for your situation and me, I'm thinking about